morning. I'm going to do an incident spirometry. So the first thing I need to do is check the patient's chart to see what the doctor had ordered, and then I'm going to look at their medications that they are given, and like their pain medications and coincide then with what's called here is a volumetric exerciser is what I'm going to use today to help the patients get their lung volume bigger and better. That way they can open up their lungs, especially when I want to assess and instruct the patient pre-operative. That way they understand that they are going to need to undergo some exercises to help them, so that way they don't get any atelectasis or anything like that. So when I'm ready, I'll take in my volumetric exerciser and with me. Then I'd always introduce myself. Hi, Mr. Smith. My name is Amy, and I'm a respiratory care student with the respiratory care department. And then I'd also check their ID band before I begin to help them. So I'd wash my hands, properly dry them, and dispose of everything. And then I'd also wear the appropriate PPE. I can wear gloves, just wear gloves with this, because I don't feel like there's going to be any splashing or anything like that. And so I would go to the patient, and then I would get their vital signs, check their lung sounds, to auscultate the lungs to see what they sound like, see if they're coarse, anything like that, if I listen to and hear any odd sounds inside. So then I'd get my machine ready. And with this machine, there's always a chart that goes with it. So you'll need to chart down if they're female or a male, and then how old they are, and estimate their height. If they don't have it in their chart, if they didn't have their height in their chart, kind of estimates what they're at. And say if they're post-operative, I would start them out at a lower one than what this one says, just to work them up, because you don't want to overwhelm them or when they cause them any more pain than what they're in. So I'm going to get the machine ready, and I'm going to set it. So I'm going to use me as the patient to demonstrate. And so I'm about 1900, 1850 is about where I'm at. So I'm just going to go right here, right in the middle, 2000, 1500, to see where, if I can get up that far. And when I do this, I will see how far, if they're at the best, better, good, with their inspiratory volume, and then I would record where their first inspired volume reaches to. Now, when I hook this up, I'm going to hook this up here. And you want to have it lay flat for the patient. You don't want it hanging upside down, because if you hang it upside down, it's not going to read properly for that. It's just going to fall down. So when you do this, you have to take a first initial breath in and exhale. That way you get a good inspiration when you do the machine. So I'm going to take a deep breath in, and then exhale, and then I do this. And when they inhale, you do about 3 to 5 second inhale, and then you would wait until this reaches to the bottom, and then they have the patient exhale from the machine. Now you can have it, if they're capable of doing it a couple times, give them a little break before you do the next one. And there's a little machine that you can hook on to here to read also to read the tidal volume and measure all the capacity, the volume capacity that the patient's lungs are at. So then if they're okay, then I can instruct them how to do it the 6 to 10 times per hour. And if they can't get that, we'll just work our way up and get them to where they need to be to get their lung volume up. And with these, there's a little label at the bottom. You can put their patient's name there, patient's room number, and the date that I have given them this machine. And that way when they go home, they can also practice doing this at home, helping them get their lung volume, keeping their lungs nice, open, and strong. And then I would wash my hands after I do a procedure. And then I would re-instruct the assess the patient. I would check their vital signs and assess lungs, see if their lung sounds sound good, if they're not as coarse, or if they're if it makes it sound better or not. And then I wash my hands, dry them, set this in appropriate area. So if they're not done with this, I will set it next to their bedside, like on a table, bedside table. That way they can reach it and do it continuously while I'm off doing helping other patients. Then I go and chart it on the patient's charts to let everybody know and let the doctor know that I did and tell the doctor where they are at with their inspiratory volume. And then that is it then.